Ftm top surgery is one of my favorite surgeries to perform. These patients have gone through years of transitioning, whether it's hormonal, emotional, psychological, and now for the first time they're going through a physical transition. And for me, it's amazing to see their expressions when their outside is finally matching how they've always felt on the inside. So one thing that I stress during the consultations is that this is not a breast reduction. This is chest masculinization. And there's several things that differentiate what a male chest is compared to a female's chest. So number one, contour. Obviously, a male chest is going to be flatter, so I go to great lengths to remove as much of the breast tissue as possible and contour that chest to make it look as masculine as possible. Number two, areola size. Obviously, male areolas are going to be smaller than female, and so I go to great lengths to match the areola size to the overall size of the patient's chest. The number three, it's the position of the areola. A female areola tends to be more centered on the breast, whereas a male areola is going to be more to the outside and a little bit above the lower border of the pec muscle. And it's this attention to detail that gets me such great results and more masculine looking chests. So there are two main types of surgeries for Ftm top surgery. Number one is the keyhole approach. Now this is a small incision on the bottom of the areola where I go in and I take out all the breast tissue. Number two is a double incision with a free nipple graft. Now this is where I go in and do basically a complete mastectomy and I move the areolas up to the proper position. Now the difference between the one surgery and the other is not so much the size of the breast, but also how much extra skin there is, as well as the location of the nipple and areolar complex. Recovery from top surgery is actually really straightforward. Patients come back to the office in the first week to get the bandages and the stitches out, and most are able to go back to work within a week. By 4 to 8 weeks, I let them go back to exercise, and really that depends on the technique that was used in surgery. So what really sets me apart from other surgeons who do top surgery is number one, I take a lot of time marking the incisions. It's really important to be very symmetric with the marking so the outcome becomes very symmetric. I can't stress to you how many times I see patients coming in from other surgeons who incisions don't match or they're in different places. It's really a frustrating thing and completely avoidable. Number two, I take a lot of time to contour the chest to match your frame. This is not a cookie cutter operation. Everything has to be in balance. Number three, I make sure that the areolas are positioned as symmetrically as possible. You don't want the nipples to be placed too high. You don't want them to be too low. They have to be in the perfect position. And then number four, I'm a meticulous closer. I close the incisions with 3 layers of sutures to ensure that they're going to heal as well as possible. And I think the other thing is that I'm the only one that you're ever going to see post-operatively. I take out every stitch, I take out every drain. You're never going to see a nurse or an MA or a PA. It's just me. And I think that that's really important to establish that patient-doctor relationship, not just before the surgery and during the surgery, but every visit thereafter, so you're feeling comfortable with the entire process.